All right, let's go ahead and get started. Let's do introductions. So I'm Jeff Goldman, Chief Probation Officer, and we'll go to the right.
Ray River, the Health and Human Services Director.
Angie Hockey, probation fiscal.
That's probation. Stay now, and at the jail.
Erin Ho, Sheriff's Office fiscal. Molly Bachagluba, admin analyst for Sheriff's Office.
Steve Sinclair, probation.
Paul Litchfield, probation.
Brendan Brown, analyst of probation.
Linda Valente, probation. Oh, yes, we'll go over.
Yeah.
Jackie Britton, district attorney, analyst.
Jamie Ogenson, Deputy County Counsel.
Go up to the screen and just scream out your name, whoever wants to go first.
Jesse, DA.
Ariel Lovett.
Cinnamon Dan. Sorry.
Go ahead, Cinnamon.
Cinnamon Danielson, Women of Worth.
And I'm Ariel Lovett, HHSA CFAO, and sorry I couldn't be there in person. I had a back-to-back, and then I was scared to be on screen because I didn't want to be big like Jesse. He's braver.
No problem. And then we got Phoebe. Announce.
Hi,
Introduce yourself.
I'm Phoebe, Behavioral Director.
And Leslie.
Hi, good morning. Leslie Williams, analyst with the Sheriff's Office.
All right, so it looks like we do not have a quorum. We're one short. I don't know if someone wants to run over and see if Carrie's.
I know where she lives, yeah. We'll go. Hi.
And maybe someone will hop on here shortly. Guess we need to take a vote. So I will skip approval of CCP minutes. We don't have a quorum. The next thing on here is public comment, but I do not see any public. So I'll skip that part and then get to the bylaws. We have a special guest today for our bylaws discussion. And so looking back at the minutes, and if some folks remember our last discussion, there was some concern and it was raised primarily by Terry and by Alex at Grass Valley PD about how the statute talks about, it's specific to certain entities having a designee, like the court, I believe, and it's silent regarding others. So there was concern if it doesn't mention others as having designees and does some, does that mean that there's some legal issues around others having designees? So that's the discussion. So I know that Jamie was going to take some notes and bring it back to her shop and have a discussion with some other attorneys in the office. So I don't know if there was any other feedback or anything else we wanted to discuss regarding that. Yeah. Jesse, you're the other attorney in the room or virtually in the room. I don't know if you had any concerns about it.
None that jump out.
And so also,
But also, Jeff, I mean, if Carrie or Alex isn't here that raised the concerns, maybe we just put a pin in it and see what the specific concerns were or what their comments on.
I mean, we have it on the minutes. I mean, essentially I can read. Like most people said, they appreciated having the option to have a designee and some flexibility. Carrie Klein brought up that if an item is left out of the statute, is left out intentionally. I had said that most examples I looked at had a designee provision in the bylaws. And then there was also, Alex brought up concerns about voting for verbal motion because there's still a lot of things to think about. Question. Oh, there you are. I was quoting you right now. So we're talking about the bylaws and the concerns about designee.
Do we ever get a legal answer on it?
Well, that's why we have our legal beagle right here.
I'm not going to provide an answer. I'm gathering the concerns and I'm bringing it back to my boss, who's a Brown Act expert. She teaches around the state on the topic. So I just want to make sure that we do exactly how she advises.
Yeah, and since Carrie wasn't here and you weren't here until right now, I was kind of going through the minutes as to what those concerns were, and you had mentioned that Carrie had mentioned about leaving something like, since it wasn't specific on all the different executive members, but it was on some, then that could have been intentional. And then you had mentioned about there just being a lot of things to think about and whether that would apply, that designee provision would apply to all members, and how it might conflict with the language in the statute.
Mhm.
So,
It's pretty accurate. I think I remembered that when you read the statute, it specifically mentions that one party can provide a designee, and then the other listed individuals by title didn't say that. And so I was just, unless there's some sort of other law on point about it, I was concerned that we could be creating something that wasn't based on the statute. And then in our bylaws, if I recall, there was what was it? There's a section that talked about going down to like who is a CCP executive member. I think we need to clean some up in there. I don't remember off the top of my head what it was.
yeah, I think the executive part is fairly clean. It's the general membership one that's a little more broad. We also talked about, so I think I provided some examples of some other bylaws. And I think you and Jamie and I also talked about it. Most of them have something in there. Some are specific. There's a handful that were specific to elected officials versus non-elected officials. And I couldn't find anything that kind of outlines that, but I don't know. It could be in some government code somewhere. But that was the other nuance or, uniqueness to some of those.
Okay.
But a lot of them just said like you could have a designee and then talked about like just the process of letting people know who your designee was.
Right.
Does our Board of Supervisors codify who are the representatives from the different sectors, or is that something done just through the CCP?
I remember, and maybe I put it in the notes, dig through the notes, but I remember one that I do remember is the department head of social services, because just how different counties are structured. And I did put in ours that the director of county health and human services has been designated to fulfill the requirement by the Board of Supes on July 26, 2011, pursuant to a letter that was Jeff Brown at the time. But I think that was the only one, just because of that different setup with, alcohol, drug, and behavioral health and all the different ways that.
You have the model of other county commissions. Oftentimes there's a single board member. All of them is backup board members. It's a lot of things like or all side of mind on presiding judge to do that based on whoever they designate. Specifically appoint people who are backups.
Yeah. And that, I guess that to me, that's kind of like if we decide we can have designees, then that's the kind of just like a process. More than the legality of like yes or no.
I see a distinction if the code says the presiding judge can just do it. Like today, it might be one of the other judges, or it may be their CEO, or it may be some.
Yeah, I think that if we got to the point where we believed that designees were allowed, either for some or all the positions, it would be nice for the bylaws to then call out what does that look like, whether it's on a whim today, I can pick person A, and next meeting I can pick person B, or do I make that a designee appointment for a year or for 2 years, or just because I do think that some consistency around the table would be good, because oftentimes, like today, we're talking about something we talked about at the last meeting. And
Yeah.
so if you have a new person every time, potentially. So I think the only spot that would list is in the bylaws if it's possible to do it.
And I think it talked about that somewhere, or maybe it was one of the other ones I've read. I've read these so many times that I'm starting to get.
Yeah, one of the
I
other
think it does
counties
talk
did
about
it,
it.
but I don't know what their authority was, if it's just general Brown Act or.
I think it was
Or
like,
what
let
it
the
was.
chair know by a certain time, but and it was kind of leading to like
In
what
writing.
Alex was saying, so it's not switching it. Like just someone shows up and says, oh, I'm the, it's a need stuff. There's a little more process.
Mhm.
And I mean, ultimately, that's the point of finally, I mean, we've gone a very long time without bylaws, but that's kind of the point of getting or putting these in place is so that we kind of set some of these processes in stone, I guess, and make sure that we're following the rules like we're supposed to. And I think, yes, there's probably, I mean, shouldn't say this, I'm not county council, but there is, I'm guessing, some liability in the way that they're formed, but I almost see it as like there's more liability of going with no bylaws whatsoever, of just flying through it. Because I mean, I think we might be the only county that I could find that didn't have any bylaws.
So these ones that you gave me are just kind of a draft, or
Yeah.
this was from a long time ago? Or you just don't have any at all?
We don't have any, so that's a draft that had been circulated.
Okay,
Executive.
got it.
I couldn't find anywhere that bylaws had ever been created. And, you know, I didn't have any information from Rotolo that it had been either, so.
Okay.
Steve's shaking his head now, so. So is there anything else that we would like for Jamie to take back to go over? Was Carrie not in there?
She's working remotely today, so I was hoping she'd pop on, but they didn't know.
Right, well, if there's nothing else, then hopefully at next meeting, you'll have some sort of guidance
Yeah,
for us.
yeah. For sure.
Any other questions about bylaws while they're out there? I think those were that was the main question I had.
Were you wanting to see if members could appear remotely too?
Oh,
The
I get-
legality of that?
That's the other piece, yeah. Jesse, you might have to walk down here, yeah. Yeah, because I think we've gotten into the habit, you know, during COVID, and I know that there were like, there was like a waiver or something and that whole process.
And state recodified that for at least boards and councils. I'd imagine it's all Brown Act bodies, so.
So, yeah, I think that it has to be an urgent excuse, like it can't be a regular thing. Like it has to, yeah, it's a just cause or an emergency.
For the meeting or for the person?
To appear remotely. Yeah. For the person. And it very specifically describes what an emergency is, and it's like, you know, illness, physical disability, or travel due to official business.
Okay.
But you still need your quorum in person.
And so, any other questions before close that item? All right. So the next thing is the data group. And so before I hand it over to Brendan, and the dashboard that he's kind of put together as a starting point. One of the things that we had talked about with data was a data literacy kind of training. And I believe most people said that would be, that folks wanted it and they would prefer that it would be in person. So I was doing a lot of research on this, and I mean, there are a lot of online resources for this kind of thing, but Chico State has put together, they have, I forget what it's called, the Data Something Initiative, and they have a group that does this. So I reached out to them and they were very excited. It sounds like not a lot of people reach out to them for this. And so we've gone back and forth, and hopefully in the next week or so, I'll have a call with them. And if anyone else is interested, you know, once we start that going to kind of get that together, they can be on that call and I'll let folks know. But basically around, they're trying to put together a proposal based on whatever our needs are. And I said, those might change because, I mean, there might be other folks in the county as well that could benefit from this. But I said, I kind of see it as like if we decided like this group wants some kind of high level training, but then maybe more in depth with like the data group, like those would be two different kind of trainings. Cause they were getting like, everyone has a computer and we're going through Excel and all this kind of stuff. And I don't know if that's for the higher level training or if it's more depth, but like I said, they were excited about it and they're open to it, and they have different professors and different, they gave me a laundry list of specialties, and criminal justice was one of them. So that was good. And their expertise. And so hopefully that will work out, and maybe it'll be something that, you know, could end up in other parts of the county as well, because they seemed open to it, and it's fairly close. At least I think it is. It's like an hour and a half or something like that. So, but anyways, I don't leave Nevada City, so I don't know how far anything is. And so the other part of that is on the data group is Brendan put together just an initial kind of dashboard, still trying to get folks around the idea of, you know, collecting data relative to this group.
Share that.
Sure. Some shenanigans in the lobby.
Yeah.
This is the first iteration of the dashboard. We've got some data on here, but you know, after we look at this, maybe we can get some feedback from everybody. But so this has first two graphs there are population for BRCS and 1170 for the past year. See like a slight decrease, but it's really not much. Like BRCS goes from 60 to or 61 to 58. 1170 is going from 18 to 14. So not big changes. Second graph is the tables from jail data. So those are if you went on bookings, that includes parole, 1170 and BRCS. And there's actually been over the last 3 quarters downward trend bookings. You look at the one below that, that shows you the average daily population over the last quarter. Total ADP, those 3 categories is 20.1. And we have data from the DA's office. This gives you an idea of their workload over the past quarter. There have been 32 adult drug court cases, 38 mental health court cases, adult drug court 81 charges, mental health court 164 charges. And over on the left, you have the current populations for the collaborative courts, and then some recidivism numbers for the various collaborative courts, and also 8109 clients. And then there's a map that shows you just like population density of AB 109. Not that doesn't include parole, that's just 1170 PRCS. So the idea with the dashboard is it's kind of a working document, and this is the first iteration. So we're just looking to improve on it and get feedback and see how useful data points are.
Out of curiosity, if you know off the top of your head or someone does, the recidivism on the top left, it says past 5 years. Is that just a straight rearrest? Is a rearrest with a conviction on a fresh charge?
So
the state definition is a 3-year look back. So
we're going with 2 years because of AB 1950. So we should turn limited to 2 years. And so that's going back 5 years, and then.
But with a 2-year recidivism.
Yeah, so it'd be like cohort comes in and say 2020. And they have a new conviction from between their start date and 2 years after their start date. They would be considered a recidivist, recidivator. Yeah, so it's a new conviction.
And we're open, I mean, and we've had this discussion before, we're open to like different metrics like, because in my mind, there's about 4 or 5 different metrics that are good at kind of giving you a holistic look at recidivism. The reason why internally we've kind of done this cohort model, because that's how the state does it with parole. So we wanted to be able to kind of compare like how's parole doing for a variety of reasons, but they put people into these cohorts and then track them across.
We used to we would do, everybody who was on probation during that year, take the number of people who recidivated divided by the total population that year. But then you think about, maybe it occurs more often at the beginning or the back end, so that those kinds of things could be affecting that number. So we figured the cohort model would be, more accurate showing.
But like I said,
More consistent would be a better word.
We're open, and this is kind of like he said, the starting point. So if there's other metrics this group wants to see, like whether it's arrest stuff or whether it's some of the work like that we're doing in stepping up, of which ones cross over to behavioral health or like those sorts of things. Like, I mean, obviously not at the client level, but on a aggregate level of and I think like ADC, I think a good thing would be like, because those folks are generally people that have like a suspended sentence hanging over their head of, I think that helps tell the story of that. Okay, why is the recidivism rate of like allegedly your most successful kind of and highest level of kind of intervention hands-on things so high? Well, those are folks that they've gone through 20 different steps before they've got, and not saying that we can't like try to chip away at that by, trying to improve upon the program, but at least it tells the story a little more.
Well, it might be interesting, like on that population set too, to look at it over a whole 5-year period, because we have also seen ADC clients, just in my personal experience, like you said, it's a pretty high needs group, and so that recidivism is likely. But I've seen it occur on reincarceration during ADC. Now, I don't know if they're actually being charged on those underlying offenses, but it would be interesting to say, okay, for the people who didn't have their suspended sentence implemented, so they didn't say go to prison or local custody, they graduated ADC, what's 5 years look like? It might look better than that.
Yeah.
If you've successfully graduated the program.
Yeah.
Versus just recidivism within the cohort.
Yeah, and I mean, not to get too far into the weeds on ADC, but I have seen like with some of those collaborative courts where essentially the seed is planted there and they might not do well when they're in that court, but when they come out from that period of incarceration or whatever, they've acquired some skills that help them in that next kind of phase. I think Sam had his hand up, although I don't see him up there anymore.
Yeah, thanks. Just real quick, I kind of agree with Alex to some extent. I think the rearrest, rebooking, whichever, I think it's important because one, it'll tell the story. How many times are people having issues or at least having encounters with law enforcement that bring them to custody, at least, because recidivism is pretty specific. And what can happen is somebody could get in trouble a bunch of times, much like we all know, but then those cases all get combined and could get pled out in different ways. They could become just a probation violation, but it doesn't mean all these other things weren't happening and that there wasn't impact in other areas. But it also can tell a story about what gets somebody to help, because as much as people don't want to believe it, incarceration is a big part of that. Sometimes some people have got their life together because of incarceration, much like Jeff just said. And so I think tracking, whether it's booking or arrest data, is important because it tells a story behind what's going on. Because even some of the stuff that like where AB 109 numbers are going down, well, people could sit in custody for a long time on something that is relatively consistent with like a AB 109 type of thing, and then that case changes or shifts based on legal stuff and everything, and then all of a sudden it's not, right? That case gets dropped, they actually amend it to another case or whatever. There's so many different various things that can occur that the numbers don't just tell a clear story all the time. And I think the more that we capture, the better off we'll be. And I don't know what that story will tell because we haven't compared them side by side, but I love what you guys are doing with the dashboard.
Yeah, and so I mean, the way I look at data is like, we don't want to just collect data to collect data. We want it to inform whatever we want to do with this group, as well as, what was I going to say? So we want
It should be
to,
purpose, there should be purpose behind it.
yeah,
And I agree with that statement. I just think that the level of what recidivism is so far off from what people envision, and whether parole or the state chooses to use that. When you talk to somebody in the public and you say, hey, we have a low recidivism rate, but that person that we're talking about, even though they've been booked like 8 times, only has one recidivism number, the public doesn't understand the difference of that. And I think it is important. And it tells a story about like what we even do in the jail and the amount of times somebody has to be contacted before. So I think that piece specifically does have some relevance on how we do business.
I'm not saying it doesn't, because that's why I started the conversation with saying, I think there's multiple ways to look at it. I mean, I've worked in an organization that drilled down all the way to like FI cards, like all the police departments. And that wasn't that, I mean, yeah, I'm guessing those don't exist anymore, but.
No, we do. They're not on cards, they're digital, but yeah, I know what you're talking about.
But the purpose wasn't even like context, because it could be positive or negative. The purpose was for funding purposes, because the police departments received funding for, the impact of AB 109 at that time. And so the purpose was, how much interaction are you actually having with folks that are on probation, parole, whatever? And so it wasn't just a number, there was a reason behind it. So we submitted this information and collected it. So it could be like, well, we had 1,000 contacts with probationers last year. And so, okay, well, we need to up the funding or lower the funding or whatever based on that. So I think, this being the starting point of, yes, it has kind of those classical things of the outputs of this is the number of people and this is the recidivism level, but it doesn't have to even be those things. It can expand beyond that. But I also, when I say like collect things just to collect it, the dashboards I have, like years ago, like a dashboard, and most of you guys know Kevin O'Connell. So years ago, him and I were working on a project, and it was like, we came up with the idea. It started to look like the Simpsons car. I don't know if anyone watched Simpsons, but he built this car that's got like a dome on it. And like, it's like a car part from every possible car that you could imagine, just looks all random and doesn't really do anything. And so we don't want it to get like that, to where it's like this just hodgepodge of like randomness. And I know that years ago when we kind of started this internally, we had a staff member that was like, well, I'd like to know like what color their eyes are and all this kind of stuff. And it got to be where it was like this ridiculous thing. So we want to make sure like we have that purpose. And then the other piece is the understanding that these don't answer our questions. Generally, this just creates more questions, which is good. Like it shows you something, goes, well, now I want to know this, because now that I know that, it makes me think about this. So it's like, this is kind of that starting point of kind of developing those questions and like honing in on those things. So it's kind of like this never ending process sometimes as you're peeling away the onion.
I was gonna say, so we're gonna send out a PDF of this with the minutes, and if the departments could look at it, give feedback to their data work group member, and then the next data work group meeting, we could look at ways to add more things or revise things. And in addition to that, just on the topic of not getting too granular, you also can do like drill throughs. So you could have the landing page and then drill through something to another page to get a more granular look at what's going on. So that's a way to avoid things being overwhelming.
Yeah.
Yeah, I mean, I was thinking like this is more kind of I don't know if the plan is to put this as public facing, but this is more the public facing piece, that it's that really high level overview stuff. And then as you can drill, because I think there's about 7 different ways on the recidivism to kind of look at different felony, misdemeanor, returns to custody, arrests, all those kind of things. But that would be more something you can just kind of drill through and get down to those, what are some of those trends?
Phoebe had a comment in the chat. She said, should mental health diversion be included in the court list? We have a ton of people in that program.
Yeah, I think initially it was, I mean, Brandon, you can correct me if I'm wrong, like funded programs. So ADC, there's a couple of entities that get funding from 109. So that was kind of the starting point of where funding's going. So I think that's why that was selected. I mean, pretrial now gets some funding from AB 109. So maybe that should be included as well. And does everybody understand like the functionality that Brandon's talking about drilling down? I mean, I think nowadays, post-COVID, when there was dashboards everywhere, let's understand it, get that functionality, but. Any other questions, comments, concerns? Do think eventually, like, because the uniqueness of this group and who's a part of it with the courts and everyone else, that we do have the opportunity to gather a lot of information and kind of that we might not in other settings, and that be very informative, especially with the start of CalAim might be helpful in some of that decision-making process as well. All right, you have any comments? Yeah.
Eager to look at it, so.
Is it something that lives in probation, or can other people have access to it to
So this is.
run reports?
Power BI, need a license. To Power BI. But public facing stuff, like on a website, you don't need a license to use. So there's some form of it we want to present publicly, or you can send out PDFs too. It's just not as interactive, obviously.
Can you get a read-only like type license through Power BI or no?
You could.
Tableau.
So if folks have a Power BI license, can they get to it, or is it? Okay.
Except for share.
Sure. It doesn't allow you to get down to the individual level, I assume, so no.
Yeah, you can set it up to, it won't. Yeah, in fact, most of the stuff I will just aggregate before it even goes in.
I do think, I mean, for the departments that don't have the Power BI license, I do think the county is pushing to, because they kind of pushed this out of Tableau into Power BI, like for people to start.
Not yet, Jeff. When I talked to Steve, we're not at that point where there's enough licenses to make it where everybody has it.
Yeah, that's what I was getting to, was that like, if people start requesting it, eventually we'll get to some sort of enterprise licensing or something like that, to where everyone has it on their county desktop or laptop or whatever you call it nowadays. All right. The next thing we have, real quick before we go to CalAim, I was gonna, Angie, budget update, because there is an update relative to base funding on the budget.
Yeah, so the fiscal year 23-24 CCP base allocation missed budget at the state level by about $12 million. So in talking with CSAC and the state controller's office, there will be backfill to get us up to base, and that'll happen kind of when revenue is available. So ultimately, we are down a little bit from what we'd estimated at the beginning of the year, so still growth coming through. But essentially, we'll just be same base this year as we were last year. So from our initial budget in February, we're down about 200,000 from what we had estimated. But our the July estimate, I think that we gave it our last CCP or some time recently, it's not as significant because we'd already seen the trend downward. So, but it's essentially
Questions on that? No, okay. Next thing on here is CalAim, and I just put that on there just because it's kind of impacts most of the folks in this group. I was gone last week, but it seemed like there must have been like 20 CalAim meetings while I was gone. So it's like everybody's having one now. Like if you're not having one, you're not a crowd. But so I don't know if anyone wants to kind of discuss that, at least from our perspective. I mean, yes, we have stuff in the adult side that we have to work on, but right now our kind of priority is the juvenile side, just because we got information from the institution housing our kids that they've changed their mind on what they're going to do. So we're working on that. So we did submit an application, I guess if you can call it that, the initial kind of interest card for funding for phase 3, path 3 funding. So we'll see what happens with that. And it does sound like counties without juvenile halls, they must have a lot of extra money. They're just giving them, millions of dollars. So we'll see what happens. Does anyone else have any, looking out right here, side of the table, any CalAim updates that they want to share with the group?
Jeb,
Yeah.
I was just gonna like zoom back for one sec just to ground everybody in like just a reminder, like CalAim is a big term. And
Yeah.
for those that aren't tracking on it, it's like a much larger policy initiative to make the broad Medi-Cal system more effective in attaining quality health outcomes for people on Medi-Cal in California. And there's a ton of initiatives under that CalAim broad umbrella, one of which is the Justice Involved Initiative. And that grew out of the fact that people who go in and out of incarceration have very poor health outcomes in lots of areas. And so the goal of the Justice Involved strand of the CalAim policy initiative is to link people better to care and services during that period of incarceration and upon exit, so that they both ideally don't go back to jail, but also are better connected into treatment resources they need, whether those are behavioral health treatment resources or healthcare resources, as well as housing supports. And so like some of the CalAim Justice Involved Initiative is very specific to jails and juvenile halls, and our jails feeling the pain of that. Some of it's specific to behavioral health in terms of like doing in-reach and linkages so that as people exit incarceration, they enter into like established appointments with care providers, et cetera. And then some of it touches other systems than just ours. But just to give some context to it, there's lots of other strands to CalAim focused on other high-risk populations, like people experiencing homelessness or seniors or foster youth, et cetera, as well as sort of the behavioral health system in general.
Sorry, I was being a little justice centric.
No, that's okay. I mean, totally appropriate, obviously, but like just to give it context so it makes sense of like why it exists or whatever.
I don't know that we have a lot of specific updates, except that we're working on the readiness assessment phase of the project, which we hope to submit by the end of the year, beginning of next year. And that needs to be submitted 6 months before we go live. So, or that we want to go live. DHCS has to approve it. So we're actively, always leading that effort. We're actively working on it. Working with a lot of people in the room on that effort. So.
And I know different counties, I know Phoebe sent me something, I think yesterday, about El Dorado County, where probation's taking a lead on a lot of stuff. And I mean, I think it's just the dynamics of different counties, because like I told her, I mean, I know the chief over there, and it was, from what I was told, that the sheriff kind of took like, not my problem kind of approach to it. So he kind of filled that void. But it looks different, in every.
It does look different.
In every county.
Counties, sometimes it's public health, HHSA generally, that's taking the lead. I think a lot of it depends on who manages the healthcare in the jail or in the correctional systems. Ends up being the lead on the CalAim TI effort.
Yeah, Napa County, I corresponded with their HHS director yesterday, and they have a juvenile hall and the jail, and they both use WellPath. So they're officers, the chart that has been nice. All that.
So their jail's not under the sheriff's department either. And right. They have a corrections. It's the one separate one. Yeah.
But even with similar setups, just to throw out more complications, some people are just letting WellPath do everything for them. And then like we're looking at options of WellPath or having our own EHR for an electronic health record, and then a third-party biller. And so you could take the same dynamic, but what if the vendor leaves, and then what are you left with, like in holding up a system? And there's path funding that can help support specifically for what we need to do, and we budgeted for that in our path funding. And so we have some really potentially big decision points we have to make, and just a shout out to HHSA, Ryan and Phoebe for helping us, because it's outside of our realm. So Jeff, on your guys' end for probation, like, what do we know about medical care, right? And so some departments have like chief medical officers that they employ that oversees their medical contract. There's a lot of pieces to it and things we don't understand. So I really appreciate my team and what they've done, but CalAim's a giant monster, and it is a ship being built in the air. So even if you ask questions from DHCS, they don't have answers. So, yeah.
And so, are any other CalAim questions, concerns, updates?
I mean, I would add, and I agree in terms of the complication and that it's a whole new world. And I think there are some really great ideas that are at the core of it, and it's the implementation that's really challenging. But the idea of a broader definition of healthcare and more in reach into the jail and being able to leverage Medi-Cal dollars to provide services that are currently general funded, I think there's a lot of opportunity there, but it's no easy task flying the ship that's in the air and being built at the same time.
So the next item we had was strategic plan update, and I just put this on here because it's kind of a standing item in hopes that people would take a look at it every once in a while. One of the things I was thinking about, because this week some folks, Harry and I, had the they're called like the Community Academy, what's the thing? Citizen Academy. And a couple other presentations that we've been involved in. And so one of the pieces of that was the outreach, because the biggest thing when we did our strategic planning was like a lot of people just didn't know what the CCP does or what we do. And I think I told this to Ryan, there's a guy on the no, not the Citizens Academy, the grand jury, that every single time I give a presentation, he asks me the same question about the CCP. And I say, well, you can come. And, and then he talks about this one time when he went, and it's the same thing. But those opportunities for outreach, I know we had done some like Kiwanis or Rotary Club and that kind of stuff. But if anyone has that, anything come up and they feel that it'd be appropriate and we have those opportunities, let folks in this group know. And we can do that. I do think usually after we give our presentation or spiel, usually they're like, oh, I didn't even know this exists. And they have questions and they're interested in it. Not saying that people are showing up, taking time off work in here and come to the meeting. But I do think it's important to kind of get that information out to the group. So if those come up, to try to keep that on your radar. The CCP plan for next year, I was hoping to have a little more information. So we discussed this to a certain extent. So we used to do this plan and essentially we would send it to BSCC, the Bureau of State and Community Corrections. It's had a variety of names over the last 10, 20 years, but we would send it to them. And if you had it to them by December 31st, they would give your county, I think, small was like 100,000, medium was 150, and large was like 200,000. So we get this planning money that they would send every year. So that was cut in the governor's budget. So there's this discussion of like, well, do we even need to send a plan in anymore? The piece still exists that the budget, it's kind of a nuance. It doesn't have to be approved. It just, if they don't approve it, it has to be not approved by, I think, like a 4/5 vote or something like that. Is that right? 4/5? Yeah. And so there's also an argument that, well, we all submitted our budgets. The CCP budget's a part of that. So they already approved the budget. So is there any need to do the plan? And that, I know that we kind of had an internal discussion about the importance of the plan and other purposes. And I know we just talked about the community having access to information about CCP. So that's one piece. But the other piece is like, do we have to do it in the same time frame as always? Because that has to do with board dates and everything else, and doing a presentation before December 31st and all that. So far, my understanding is no. Like we could still do the plan, give a board presentation, allow them to ask questions, stuff like that, but we don't need to do it in that same process. BSCC was supposed to be at my chief's meeting tomorrow, but they've canceled, so I was hoping to get more information soon about that. I do know that there are counties that don't really care about the money as much, that have not. I know, well, I'll say this specifically. Placer County said they weren't doing a plan. BSCC came to them and said, please do a plan. And they said, no, we don't want the money. We don't care. We're not doing a plan. And
This is when the money was still out there.
yeah, because the money thing is just this year. And so eventually Placer County said, or BSCC said, how about the plan you did that you're required to do in 2011, just send us that same one every single year. So that's what they've been doing for the last however many, or 13, 14 years. They have never updated a plan. They've never changed anything as far as the way they divide up the money or spend the money. They have a percentage. They've done it the same way. They don't, I don't even know what they mean. And they don't care about the $150,000. So it makes me think like all the information I've gotten is that, yes, we probably can do it however we want to now if we're not interested in getting the money because there's no money available anymore. So, because other counties were already kind of doing that. And so I know that Steve has sent out to folks a request to kind of look at your piece of the plan and update that if you want to. So, I mean, not if you want to, but if there's things that you want to update in there.
I think for the years that we had a plan and how it kind of would go, where we would do some updates, but it basically stayed very stagnant, maybe at times a little bit out of date, you know. I think that this kind of model that we've done over the last couple of years, I like it a lot better. It makes a lot more sense where actually the agencies that are involved in the CCP are creating and modifying and doing their pieces, and it's just makes the whole thing more digestible and easy to do. So I really would, even though I'm not part of the exec, would say that I like the concept of continuing the plans. I think there's a little bit of momentum there with that, and it's a fairly simple thing where we could modify, you know, each year based on what's actually going on.
Yeah, and I do think it's helpful, like I said, as a document to be able to share whatever's going on and some accountability pieces to it, as well as any one of us aren't here at some point, like doing something else. Huh?
The roadmap.
Yeah, like Mike, who will be here only until January and then he's retiring. That, yeah, the next person can come along and it exists. Because like you were saying, when I first started here and I looked at the plan, it was like a lot of things just hadn't been, it remained pretty status quo from the original plan, and some things were pretty out of date. So is there any, I mean, we don't need a motion on this, but is there any conversation that folks want to have about the approach to the plans? I know in the last meeting, I think the sheriff's department said they like to be able to update those things and put those things in there. I think it does help guide the budget discussions as well.
Can you just clarify that, Jeff? What?
Is that we continue to do it how we're doing it, but we don't have to have as strict kind of, like before it was like these deadlines and stuff like that. And now we can kind of change those. I do think once we get the bylaws in place, we should talk more about setting up kind of a calendar for the year of like, I know we've talked about budget before because you've given some dates out about when you need it so that you can get your stuff done. But I do think that that will be a part of it, of saying like, okay, let's every year update the plan by this date. Well, if we want to give a board presentation, we'll do it by this date and get it kind of lined out. But right now we're kind of in that weird mix of making that transition, I think. And like I said, I think it also helps when the bylaws are in place so we can kind of have more guidelines to that kind of stuff. Does that sort of make sense? Yeah. Yeah.
You had a time frame in mind, like, are you thinking? I don't know, you guys aren't as maybe driven as much by the budget timeline as some of us are. And so that, like if you were thinking that was the time frame, that would be a little more challenging. But
Yeah, I mean, I would still like to have it done sooner than later. I mean, because when we last talked about it, we had talked about still having to go in that time frame. I mean, I know that's coming quick by the time you get it into Legistar and all that kind of stuff. But I mean, I would still like to give the presentation no later than like January, February. Yeah. That, you gave me a look. Yeah. Well, I mean, just for the plan, not, I mean, obviously it's not like we're the whole budget. And when it goes to the board, it's usually, they listen, they don't usually have a ton of questions and, maybe that will change. And I think it'll be helpful, instead of doing it before December with a new board member coming in, it might be helpful to kind of introduce them to that as well. So.
Question I have would be, would you be just taking the plan to the board and not the budget documents that generally accompany?
Yeah, I think
them?
I'd just do it as a presentation. Because, I mean, obviously they've seen the budget when it went through and we discuss, I mean, in budget subcommittee, that's something that we discuss with them. So I don't think it's like we're hiding the budget or anything.
Chat comment from Leslie going back to outreach. She said county PIOs are often looking for content from news releases. A good feature on CCP could help with some public outreach and education. We could certainly pitch it to the CEO's office for a news feature.
Yeah. I think we've done it at least. We've done it once or twice, maybe.
There's something in the county letter, the email that comes through that was about the CCP, and maybe it was around the strategic planning kind of initiatives, but that's been a couple years now.
Yeah. Let's see. Strategic plan was all right. Any other questions on the plan and as I find out more, and I mean, maybe I'll contact, since we're not having that meeting tomorrow, maybe I'll contact, either the Chiefs Association or the SCC directly and just try to get more on that. And it's usually pretty easy to do because the head of that group is a former chief PO, so it's easy to get that information.
You mentioned that you would like to actually have a presentation sometime, maybe late January, early February. So is there a date in your mind that we want to get the stuff back to get?
You can set that.
Okay.
You're asking for
Late
it.
January is usually a board workshop, so you probably have to do early January or February,
Okay.
unless you want to see us off, but incorporated into.
All right. Any other, a public comment on here again, but again, no public. Is there any other questions, comments, concerns? I know that Linda wanted us to discuss setting, because I think this is the last one that was on the calendar and we had, what was kind of the frequency?
It's been fourth Thursday. That just here and there.
It was like, was it quarterly?
Oh, sorry, yes, quarterly, yes, first month of the quarter. Is the pattern we've been using, so. We just don't have them on Outlook yet for that calendar year.
Does that work for everyone? And I think we had some caveats in there for the budget time because sometimes we need to meet a little more frequently and or based on the timing of what we get for budgeting. That changes a little bit. And then also we had discussed, so I'm going to, and it makes it a little bit difficult until the bylaws are done, but we had discussed the majority of counties and my experience has been, I think Steve's experience as well, because those two groups, like Alex had alluded to earlier, there's in the code, there's the executive group and then there's the CCP as a general group. We had discussed having it kind of broken up, at least on paper, of like 30 minutes is the general group and 30 minutes is the exec group. And so we might, I shouldn't say might, we're going to send it out like that. So it's kind of broken up like that and we'll send it out to folks and we'll, as soon as we get the bylaws done, we can define to make sure that we have those people invited that would fall into that statutory side of the general group as well. And so I'll look over that again, and maybe send out like who I think those people would be. And so we can start making sure that they're invited. I think most of them are invited already that would fall into that group. It's just trying to get some attendance, so.
Just a reminder, circle back to approving the minutes since Alex is here. Do we have a quorum now?
Well, we don't have an in-person quorum. And I was informed by my legal counsel that that is,
Provision's not violent.
it's not appropriate.
I could leave the room and you could do it.
Yeah. We've been doing it.
That's sound advice, Jamie, sound advice.
Someone call Jamie.
All right, so the minutes, the August minutes, can I get a motion to approve? Although it does say April on the copy that I have. Yes.
Approve with amendments.
Yeah. First, can I get a second?
Second?
Oh, at least the votes were in the room. Or the motion was in the room. All right, can I get a vote to approve the minutes from August, to amend them to say August instead of April? All those in favor say aye.
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 Says
I didn't, Jesse, you didn't officially say aye, so I'm not gonna accept that.
He winked.
Aye.
All right. Any opposed? Any abstain? Hearing none, motion carries.
Somebody sues us, we'll have to unapprove the minutes.
Yeah. All right, that's it. So meeting is adjourned. I won't ask for a motion to close the meeting.
So was it legal?
Yeah. All right, thank you.